Hi, I'm Keith Lonergan, one of the orthopedic surgeons with Steadman Hawkins. I wanted to put this video together for you to reference about post-fracture care for your extremity. This is going to be a general video about things to look for after you've sustained a fracture, and ones that have been operated on or ones that are non-operative and are placed in a cast. This is more geared towards those fractures that are severe enough to require surgical intervention, but certainly the same principles apply for those fractures that are treated non-operatively. There's no good time to have a fracture. We know that, and we try to get you back to your previous state of health and function as soon as possible. But unfortunately, after you've broken a bone, it takes a period of time to heal and then to rehab that extremity back to your normal function. When the bone breaks, you oftentimes get some swelling in that area, and which needs to be addressed both in the preoperative and the postoperative setting. The biggest thing about getting the swelling out of the extremity is that it provides a source of pain relief, as well as to provide a healthy environment in order to do the surgery and the surgical incisions that are required. The biggest and most important things with any fracture is to get the extremity or the body part, be it the hand, wrist, knee, or ankle, as elevated as possible. That will provide the ability for the fluid in that extremity to flow back towards the heart and then get recirculated into the body. When it comes down to preparing the extremity for surgery, we want to try to minimize the swelling. We'll oftentimes tell you to elevate that extremity until it's time for surgery. Postoperatively is the same thing. It oftentimes requires several days of continuing to elevate the extremity and provide the flow of fluid out of that back to the heart. When we talk about elevation, in particular, if it's an upper extremity, the upper extremity, we try to get everything above the level of your heart. So if it's your hand or your wrist or your elbow, we want you to elevate that up above the level of your heart so that the fingers are pointed up towards the ceiling, so that all the fluid can travel out of the extremity and back to your heart. Certainly if it's a lower extremity, we like to see you lying down with that extremity up above the level of your heart, either as you're laying on a couch with the ankle or leg on top of the couch to provide you that ability to get the swelling out. In the postoperative period, it's imperative to keep the extremity elevated. We also try to get you the ability to get some cold therapy, either with ice or special devices, to provide the cooling temperature to that extremity and help you with your swelling and pain relief. Fractures in general take anywhere, provided depending upon your age, anywhere from 4 to 6 weeks up to a few months to heal. In general terms, most fractures, certainly if they've been stabilized with surgical interventions such as what we call an open reduction internal fixation, which is plates and screws, or what we call an intramedullary device or a metal rod that may go down the bone with special screws on each end. These things will provide stability to the bone, but the bone still has to heal around that metal in order for it to be stable. In most fractures, within 6 to 8 weeks, you are out of immobilization and you are starting to either weight bear or come out of a cast or a splint, because the most important thing for any fracture around any joint is to rigidly fix and stabilize the fracture and then get the joints moving as soon as possible to avoid any stiffness. We oftentimes get calls from patients in the postoperative period that are having a significant amount of discomfort, and simple measures such as elevating the extremity, loosening up the ACE bandage or the dressings, because as the swelling occurs, the bandages can get somewhat tight and constrictive. So the first moves are always to elevate the extremity and loosen up all the dressings, and see how the discomfort does over the next 15 to 20 minutes. Their discomfort generally will subside substantially. If you are having problems with numbness or tingling in the extremities, that may be an indicator that the dressing is too tight or that you're developing too much swelling, and that those same maneuvers will help. The pain medications are certainly a part of any postoperative pain control. We oftentimes would recommend some brief narcotic medication usage. If you find that your pain is unrelenting or you need to try a different medicine, then we can always switch you out to something that may provide a better relief. Some of the things that we look for as a critical problem in a postoperative fracture setting is if you've elevated the extremity, you have loosened the dressings, and you still have numbness, tingling, or decreased blood flow, which can be indicated by a dusky color to the fingers or toes, or blanching that does not rapidly turn pink after the pressure is relieved. Those are situations that we would want you to call the office immediately and inform us of that situation. If you have done all these maneuvers and you're still having problems, you always need to call in order to get some guidance. When you come back from a fracture, there's oftentimes a period of rehab. We'll get you involved as soon as possible and get you weight bearing on that extremity or using that extremity as soon as you can. If you have any further questions about your fracture care, please don't hesitate to call us.